The next skill is administering a tube feeding. First, you would gather the equipment, check the amount, concentration, type, frequency of tube feeding, and the patient's medical record. Check formula expiration date. Perform hand hygiene, place proper PPE if necessary. Identify your patient, explain the procedure, what is going to be done, why it's being done. Assemble the equipment on the overbed table. Next, you would check the patient's or close the patient's bedside curtain or door to the room to provide privacy. You would position the patient with your HOB elevated at least 30 to 45 degrees or near normal position for eating as possible. Confirm placement of the nasogastric tube in the patient's stomach using at least 2 of the methods mentioned in Skill 11.2. Put on gloves, unsecure the tube from the patient's gown, verify the position by marking on the tube at the nostril, measure length of the exposed tube and compare with the documented length, check the pH and visualize aspirated contents, check for color and consistency. Again, if it is not possible to aspirate contents, assessments to check placement are inconclusive. After multiple steps have been taken to ensure that the feeding tube is located in the stomach or small intestine, you should aspirate all gastric contents with a syringe and measure to check for gastric residual, the amount of feeding remaining in the stomach. Return to the residual-based facility policy. Proceed with feeding if amount of residual does not exceed a facility policy or limit indicated in the medical record. Flush the tube with 30 to 50 ml of water for irrigation. Disconnect the syringe from tubing and cap the end of the tubing while preparing the formula feeding equipment. Put gloves on before preparing, assembling, and handling any part of the feeding system. Administer the feeding. When using a feeding bag administration system, you should label the bag and or the tubing with date and time, hang the bag on the IV pole, and adjust about 12 inches above the stomach and clamp the tubing. Check expiration date, cleanse the top of feeding container with disinfectant before opening, pour formula into feeding bag and allow the solution to run through, close the clamp. Attach feeding administration set to feeding tube, open the clamp, and regulate drip according to medical order. Add 30 to 60 ml of water for irrigation to feeding bag when feeding is almost completed and allow it to run through the tube. Clamp the tubing immediately after water has been instilled. Disconnect feeding administration set from feeding tube and clamp the tube and cover with cap. If you're using a large syringe, remove plunger from 30 to 60 ml syringe, attach syringe to feeding tube, and pour pre-measured amount of tube feeding formula into the syringe. Open the clamp of the feeding tube and allow the formula to enter the tube. Regulate rate, fast or slow, by height of the syringe. Do not push formula with syringe plunge. When feeding is almost completed, add 30 to 60 ml of water for irrigation to the syringe and allow it to run through the tube. When the syringe has emptied, hold the syringe high, clamp the tube, and disconnect from tube. Cover end with cap. When using an enteral feeding pump, close the flow regulator clamp on tubing and fill feeding bag with prescribed formula as described in steps 15A and 15B. Amount used depends on facility policy. Place label on the container with patient's name, date, and time the feeding was given. Hang the feeding container on IV pole. Allow the solution to flow through the tubing. You would then connect the feeding pump following the manufacturer's directions. Set the rate. Maintain the patient in an upright position throughout the feeding. If the patient needs to lie flat temporarily, pause the feeding. Resume the feeding after the patient's position has been changed back to at least 30 to 45 degrees. Check placement of tube and gastric residual every 4 to 6 hours. Flush with 30 to 50 ml of water at least every 4 hours during continuous feeding. Observe the patient's response during and after the feeding, and assess the abdomen at least once during your shift. Have the patient remain in a straight position for at least 1 hour after the feeding. Remove equipment and return patient to his position of comfort. Remove gloves, lower the bed, raise the side rail. And then you would then put on gloves, wash and clean the equipment or replace according to facility policy. Remove gloves, additional PPE, and perform hand hygiene.